Welcome to the 8-Minute Rule podcast, where actual physical therapists share clinical pearls designed to create conversation around what's getting results in the clinic. No fluff, no Medicare stopwatch, only quality content. Welcome back to the 8-Minute Rule. I've got Mark and Drew here with me again. What we would like to talk about today is mentorship, every new hire's favorite topic, which is for good reason. So before we get into that, nice little icebreaker, since we are around the Halloween time. Mark and Drew, what is the coolest Halloween costume that you guys have dressed up in? Excited for this.
I'll go first. I'm trying to remember all of them. I know I was Batman at least once or twice, and Batman's awesome anyway. So even if it wasn't the best costume, it's still pretty awesome, I feel like.
Take it. It's acceptable. Drew,
Ooh, that's a tough one.
keep it appropriate here. We're not the explicit podcast.
The consensus was my one last year was pretty good. It was a Lord Farquaad, so that was a decent one. There was another one where people actually didn't recognize me for a minute when I walked into the clinic, and we did all the different eras of Taylor Swift. When I walked in and I had music playing, everyone took them a minute because it had the wig and lipstick and all kinds of stuff on that no one recognized. So that was a entertaining one.
I do remember that. That was impressive. I will give you that. For those that don't know, our clinics dress up every year. I think my favorite one actually was our clinic had 7 people in it at a time. Probably about, I guess it's 7 years ago. My daughter was 3. She wanted to be Snow White, so we all dressed up as the 7 dwarfs. And then she came in about halfway through the day, and we were Snow White and the 7 dwarfs,
That's
which was
awesome.
a lot of fun. So, anyways, on to mentorship. One of the first things I want to ask you guys, as you're kind of thinking through sharing some knowledge on this, and you guys are extremely qualified as fellows who have done a ton of mentorship, to just give some feedback around. Let's start off. How would you balance giving guidance with letting your mentee learn through experience, which obviously can be failure and success? Drew, why don't you start us off?
Oh, that's a great question. So
Thank you.
I think one of the biggest things of with the mentorship, at least from my end, from the experience I've had both as a mentee and as a mentor, is typically that conversation even afterwards. So oftentimes, kind of stepping back as a mentor and letting the mentee work and go through. And there's some times where you kind of step in and there's like these like kind of mentorship moments where you can go in like in that time and really have something that's pretty good there. But I think a lot of, as a mentor, what I focus on is that clinical decision making and then seeing where they're at and then reviewing it. And so as you continue to see the next patient, you can continue to get better rather than being right there and giving a lot of immediate direction at the time, like in the moment with the patient. I tend to do that a little bit more with students, obviously, because they have a lot less experience. But as they get out into clinic and start gaining more and more experience, at least most of the mentoring I've done with like residents and fellows in the past, that they have decent skills already, and you want to just continue to take them to that next level. There's less of in the moment instruction here, and then it's more of hey, let's step back and let's think critically about what are the things that may be missing, what else could there be. So there's it's different depending on where that patient or where the mentee is. If we use the D1 learner who doesn't know what they don't know, you're going to be a lot more in the moment helping them out versus somebody who has a lot of knowledge. I'm going to step back a little bit more and then challenge them a little bit on their decision making because that's going to be the key where they're going to continue to develop more than, hey, here's a hand placement, here's this, or why don't you do this versus that exercise because this is what you're targeting. Like those are going to be things that I'm going to step back a little bit later.
Yeah, I agree that it depends on the mentee in a lot of cases. Where, as an example, like students need a lot more like guided thought process. So it's like, okay, if you think they're dealing with this diagnosis, then what? Then what do you do about it? And kind of guide that thought process for them. Whereas, residents or fits, it's going to be more of like the recap afterwards most of the time.
Yeah, I think like what you were saying, maybe pre-planning for earlier stages versus post-hoc recap.
Yeah, it's good stuff. I think, just digging a touch deeper in there, you kind of dug into this, but Mark, when you have a mentee, obviously they're going to have some weaknesses. They're going to have some blind spots, right? And they're younger clinicians. They got to learn. What are some strategies that you have had success with in kind of being able to pull out and help identify some of those weaknesses and blind spots?
I mean, one is exposure. Like if they're weak in a certain area or a certain technique or something very specific, I mean, you're not going to notice that until you expose them to that. So giving them a wide array of either patients or skills to practice, those are going to identify some of those more specific things. But one of the more common things that I see from students and new grads is more like biases, and that's usually the most common two are going to be confirmation bias and anchoring bias. At least that's what I've noticed in myself and with others is, and so a lot of times when they're talking through a case with you, um, they give you the information that they think's important because they've got this bias, and it's like, well, have you considered this other thing, or have you considered testing this? Like, was this on your radar? How do you know it's not this? And again, more so probing questions versus like, well, you missed this. That's usually not going to go well, but those probing questions will make them kind of step back and be like, oh, actually, I didn't really consider that. And then a lot of times, depending on the mentee, sometimes they'll rationalize their thought process, which is fine, and it's normal level of kind of discomfort when you point out something that was missed for them to try to rationalize like why they did what they did and why that's the right way to go about things. And sometimes it'll take some time for them to kind of break it down and be ultimately vulnerable to the feedback that, hey, actually, I didn't do enough to rule this other thing down, or I didn't explore other options enough in that moment. And that's okay. And reassuring and affirming with them that, like, that is okay. The patient is not dead. You are going to be fine. And a lot of times they'll calm down and be more receptive to like that kind of feedback.
Yeah, I love the phrasing of that. I can tell you have good experience with this in terms of did you consider? And it's kind of that whole blend between directly telling somebody what they need to do versus asking questions, and because you can get behind some logic that was really healthy in terms of what they're doing, and the reality is there's a lot of ways to do things. So I think that's really valuable. Drew, at least as you're working with a mentee, when do you feel like you are able to recognize when to push versus to pull back? And maybe share some pearls if you can think of those.
Yeah, again, this is a lot based on the mentee, and they kind of hit the is it the Dunning-Kruger effect, where there's this like, hey, they're on top of the world, they think they know everything. I've had the greatest program, whether it be school. I'm out here and I'm doing awesome. And then if you start asking some questions and they start doubting themselves and they go down into that, oh, I don't know anything. And so kind of recognizing where they're at and having an open conversation of like, that's normal. The resident I have right now, we were talking about this, and she's like, oh, I'm in the valley of despair, is kind of we call it, that down of like, am I ever going to get this? And that's the point where you certainly need to encourage them a little bit more and say, like, hey, you're doing a great job. Here's the really good things, and focus more on that and what they're doing well versus, hey, here's all the things that you can continue to change. Like, they're going to get there, but you have to start getting them out of that valley again to where they're, okay, I'm starting to get this. And then you can start, all right, challenging them a little bit more as they get a little bit better. So open conversation, I think, is a key point or a key thing in that mentor-mentee relationship of like, where are you at, and being vulnerable of like, hey, I've been there. It's tough. You're going to get out of it. Here's where we're going to go. And I'm going to continue to push you, but you're doing a really good job, because in those situations, they want to be pushed. They want to get better, and you don't want to blow a bunch of smoke up their butt, and like just fake it. But they do also need a lot of encouragement as they're hitting that valley in order to get them back to where they need to be, because it can be frustrating when you're suddenly like, well, I thought I knew a lot and suddenly I know nothing. So yeah, that open dialogue is key.
Yeah, I think that's really helpful. A lot of good thoughts across that. Last question for you guys to just kind of push on would be, we obviously are in an environment in outpatient physical therapy. The need for volume is important. Medicare cuts, all the good stuff that we have talked about in the past. How are you managing successfully? Because I know you guys have done this really well, but how are you managing successfully in balancing the weight of needing to see volume while still being able to develop these individuals that are needing to be mentored?
I can say sometimes it goes better than others. Sometimes it's not necessarily that anybody is pushing me to see more numbers. It's just that I have patients that need to get in. And sometimes that takes away slots that I would normally have for mentoring. We have ebbs and flows through the year where it kind of allows for natural time for mentorship, like during the summer when school's out and over like winter break when there's nobody in town. And so those are kind of natural ebbs and flows. But I can tell you during the semesters, if it's not blocked off on my schedule, like it just doesn't happen well. As far as still seeing numbers, I mean, if a mentor slash mentee does dip at all, it shouldn't be a tremendous number, like a dip in volume. There, you can usually find time to make it work sometime through the week, and maybe it is that you have a cancellation and you hop over with the mentee, or vice versa. Those are still opportunities to mentor and get mentoring, even through a natural workflow.
I would, I would, oh, I was gonna say, I would agree with that, and know that like it's a give and take from the mentor and the mentee. Again, currently I have a mentee who like we had a specific time blocked off. We ended up having, the same type of patient or the same ones over. So we're like, all right, let's do something different. So it's going through the schedule and saying, hey, here's where it looks like I've got somebody that I really want you to jump in on. And so we try to do some of those every week to where we can look and make the schedule work. And so there's a lot of fluidity driven both by myself and the mentee. So it's a give and take on both. And knowing that ultimately it's going to pay off, just making sure that they know, like, hey, we're investing a lot of time here. Here's what we want to do. Because it does take time. It does slow them down a little bit as they're trying to process. Like you have to go fast in order, or you have to go slow in order to go fast. Like if you're trying to learn something new, it kind of slows things down and you're like, oh gosh, I feel like I just am inefficient. But then they're going to get fast and efficient at it as well, and they're going to be more effective. So, beginning with the end in mind is key, but making sure it fits into your day and having both people driving that bus of where's this going to happen and when's it going to happen. So it's not all on just one person.
Yeah, I like both of those thoughts. And first from Mark, definitely hear you in the if it doesn't get scheduled, it's not going to happen. And Drew as well, driving home that it feels like you can't afford to do it, but the reality is you can't afford not to do it, and it's going to have some big time return on investment there as well too. All right, I appreciate the thoughts, fellas. Next week we're going to look on kind of the opposite side of the coin and what can mentees be doing in this space to really help drive some of their mentorship as well too. So thanks for the thoughts, and we'll see you next week.